So 5 years ago, we left the PPO health insurance plan that we were on, and we joined Samaritan Ministries. And so we're going to share our experience with that and some of the pros and cons of it. But overall, we've paid a lot less money out of pocket. We have more options when it comes to healthcare providers. And most importantly, it's freed us up to pursue entrepreneurship and to not feel tied to a 9-to-5 job. So I had a really good job at a local college that offered great benefits, and so we were on like the best PPO health insurance plan that they had, and it was really good.
Yeah,
we had a lot of good experiences with it, and a lot of other people had great things to say about it. But there were two reasons that caused us to think about switching from that. One was that we just weren't sure if we were going to be in that position or really kind of a standard 9-to-5 job for the rest of our careers. We had been considering kind of leaving that sort of career world and pursuing something more of a home-based business, something entrepreneurially. So we wanted something that could kind of transfer along with that. And then once we actually started looking into some of the other options, we realized that there's some fairly affordable options out there. There's these health share plans, and so we found Samaritan Ministries was one of them. And when we looked at what we would be paying for our family with Samaritan Ministries versus what we were paying out of pocket, kind of out of my paycheck each month for the current health insurance, we were actually going to be saving money in the long run, and that was
with like deductibles and
with
all that
deductibles
stuff
figured in. When we had our first child, and so we looked at like we paid 20% of that, which ended up being a significant amount, and so when you added all that up, we'd be paying less with Samaritan Ministries. And so we didn't know anybody doing Samaritan Ministries at the time. We knew one other family that was doing a similar health share program and asked them some questions. But ultimately, we left my PPO plan that we were on through my job. And
while I still had the job.
While I still had the job, and we joined Samaritan Ministries.
Yeah, and our experience really has been so positive. So since joining Samaritan 5 years ago, so when we joined, we had one baby. And then since then, we have had 2 other babies that we have actually had at home, home births. And then we also have had a couple emergency room visits and a couple even longer. Like our son was in the hospital for 4 or 5 days for something, and another son was in the hospital for 1 or 2 days. So we've had some more significant events, nothing totally major and catastrophic, but we have had some larger medical bills that we have had to pay for, and everything has gone really, really smoothly with Samaritan. And so just to kind of break down the costs for you of how it works and what we actually pay as a family. So we are in the classic plan. So there's like the classic and the basic. I don't really know much about the basic. So the classic plan, and for a family between 3 people and 7 people, it's the same price. It doesn't matter if 3 people or 7 people, anywhere in that range, you pay $596 per month for your share. This number has actually recently gone up. It used to be $530, but because of the increase in cost of just medical expenses over the last little bit, the price, along with everything else, has gone up to $596 per month. And then this covers, so paying $596 a month covers any medical need up to $250,000. So anything that were to happen where your bills kind of total up to $250,000, that amount per month will cover all of that. Obviously, that will cover most things. However, that does not cover some sort of catastrophic event that might happen. And so that's, I think, one of the big questions that people have is like, does this really work? Like, what if, something terrible happens and you have some terrible diagnosis or get in some terrible accident where you have medical bills that
or something that's ongoing or chronic.
Something that's ongoing. Like my medical bills are going to far exceed that $250,000. And so for that, they have a program called the Save to Share program where you put in an extra amount of money per month. So for a family, you pay up to $400 annually. So it comes out to an extra $33 a month that kind of goes in this pool of this Save to Share program. And that is for covering the costs of kind of these catastrophic events that people have, where if you kind of go beyond that $250,000 medical need, that you will be covered beyond that if you are in that Save to Share program. So we are in that. So that means that monthly, on average, we can expect to pay around $630, I believe it comes out to. So that's what we would pay on average per month. Again, every month kind of fluctuates just because of how Samaritan works, I guess I could get into this, is as opposed to traditional healthcare where when you have something happen, you let your insurance, you give them your insurance card and they bill your insurance and it all kind of gets taken care of that, and your insurance company bills you and it all kind of gets taken care of that way. It's not the same with Samaritan. It's vastly different. And so when a medical thing happens, you go to the provider and you tell them that you are self-pay. And then you file a need with Samaritan saying, we had an emergency room visit, or I had this procedure done, or I'm pregnant and I'm going to have medical expenses with that, or whatever the need is. You file that with Samaritan and let them know, and you tell the provider that you are self-pay. And then as you get medical bills from your provider for whatever it is, you submit them to Samaritan. So you scan them, take a picture of them, and you send them to Samaritan, who verifies all of the information, and then your bills, like the total amount of bills for that, then gets distributed to other members. And so each month, when you have a need, so our son recently was in the emergency room. This summer he had something happen, he was in the emergency room, and we had a bill for like $1,000 that came back to us. So I submitted that need to Samaritan, and it usually takes a couple months to process. But then after that time, I get a check from another member for their share that month, comes directly to me to pay for the cost of that bill. So I don't get a check from Samaritan, the money directly comes from another individual. And each month, when I have to pay my $596 or $630 or whatever the amount is that I need to pay, I don't give that money to Samaritan. I actually give that money directly to another individual with a need, and it will say, okay, you're giving this money to Joe Smith and he just had knee surgery. And so I know that that money is going to Joe Smith to cover the cost of his knee surgery, and I have the opportunity then to write him a note of encouragement, to let him know that we are thinking about him and praying for him, and that we hope he has a quick recovery, or whatever the thing will be. So it's really cool. We actually really, really liked that aspect of Samaritan. I think that's unique compared to even how a lot of other healthcare sharing things work, is that you actually are giving your money directly to an individual with a need to cover their bills, and you are receiving money directly from other individuals who have medical needs and are helping you cover the cost of them. So a couple things to note with Samaritan is that's the cost of like what you'll be paying monthly, but then how your needs work. So you will pay, so for every need that exceeds $400, so there's not a deductible, but for every need that exceeds $400, so say with my son's emergency room visit, the bill we got ended up being around $1,000. So we actually have to pay the first $400 of that bill, and then they will cover anything on top of the $400. So there's not, a $1,500 deductible or a $2,000 deductible or $5,000, whatever. There's nothing like that. It's just for each need that you have, you are responsible for paying the first $400, and then anything above the $400, they will cover the rest of it in full. And so that's the same for, any major hospital stay, maternity, whatever need, or anything minor like an emergency room visit, where then you'll get like $600. So that is kind of how it works. Another thing that's cool about the kind of self-pay aspect of it, and with Samaritan how it works, is because it's self-pay, they actually pretty much all that I have seen, medical providers will actually provide a discount for being self-pay. So you usually get around 25 to 30% off the cost of the procedure or whatever because you're self-pay. And so it kind of significantly reduces your medical bills. If you have a larger bill, 25 or 30% can be thousands of dollars off because of that. And so that lowers the cost of Samaritan versus what traditional health insurance is paying. So that's really cool. I think one of the big objections that people have before they're going to jump on board to joining one of these healthcare sharing sort of situations or Samaritan is, well, what if I do have a catastrophic need, right? Like, what if we have something that's like $1 million or whatever, this ongoing super expensive medical need? Like, will they really cover it, or am I going to be just in a ton of debt? So
that was our question.
That was one of the big
questions
that we had. And so I think it gave me a lot of peace of mind when one of the shares that we received, actually, so one of the months that we had to pay someone our money was for actually a family that had a son who had recently died of cancer. And so, I mean, tragic, story. And so we sent them our money. We told them, our condolences were with them and that we were praying for them. But as I thought about that family, I thought, wow, like how much money did they have to endure? Much money in medical bills did they have to endure over the last several years, including kind of covering the death and all of these things for their son's expenses. And a couple months after I submitted that bill or that money to that family to cover their costs, we actually received a personal letter from that family who reached out to every single member of Samaritan who had ever given them money over the many, many years through their son's diagnosis and treatment and ultimate passing. Just a note of thanks, saying how much of a peace of mind they had through this whole process of just knowing that their medical bills were covered, and also just saying how much of a peace of mind it was for them, not only knowing that all of their physical medical needs were covered in terms of the financial, monetary bills, but also just that their spiritual, mental, emotional needs were being met, because now there were literally thousands of people around the country that knew about what was happening, that were regularly praying for this family and their son, and just the comfort and peace that brought them, knowing that they were really in this together with kind of this community of people that was supporting them and encouraging them, and just what a blessing that was to them. So I just thought that was a really cool story, an example of a family that did have this really catastrophic need with these really significantly high medical bills that was actually they clearly communicated that all of their needs were met, that they were able to pay for their son's total care throughout the process, as well as having kind of these spiritual, emotional needs also met as well, in just a really unique way that obviously traditional healthcare cannot provide. And so that was a really cool story.
Yeah, and we should just mention up front here that Samaritan Ministries is a Christian faith-based program or group, and so that's what we're sharing about, that faith element of the community that you are joining into. And some of the other health sharing programs are faith-based as well, some are not, so there's other options out there.
Yeah.
And we know we're kind of just giving a big broad overview, and certainly you're going to have questions about how it works, so feel free to drop things in the comments below. But we're gonna go into some of the pros and the cons.
We're just gonna kind of rapid fire through some pros and cons of what our experience has been.
Yeah, so the first one is just affordability. Like, it's a great affordable option, especially like how we mentioned, we started looking into it, thinking about entrepreneurship. If you are a farmer or a homesteader, obviously this is a great option, or any other sort of home-based business or entrepreneurial.
Or even small business that might not be able to afford the cost of having a big group plan or something like that.
Yeah, it's affordable. There's plans for one person, for two people, for 3 to 7, and I think you can go higher than that too. But they're all pretty affordable when you consider what you'd be paying for other health insurance plans.
And this was a really big one for us, but just the flexibility of seeing the healthcare provider that you want to see. And so this means you get to decide, the ball is in your court to figure out the doctor, the specialist, the person that you want to see for your medical need. And so for us, this was really important. We tend to be more naturally minded whenever possible. So like we had 2 home births with the 2 births of our sons over the last couple years. And I know a lot of traditional insurance companies do not cover the cost of home birth, but Samaritan totally covers it. It's encouraged. They actually save, it's cost significantly less, so they save money, but even just the the risks of something going wrong and there kind of being additional expenses really goes down significantly with a home birth. And so it's cool to be able to just get the care that you want to get, as opposed to kind of being bound into only going to the certain list of like a couple medical providers.
The next thing is that the coverage has really been like awesome for us. Like I don't think we've had anything turned down, and not to say we've tried to like slip something in there that shouldn't have been covered, but anything, from like supplements that go along with,
they cover the cost of so if you're pregnant, any of your prenatal supplements or any supplements that you were taking for your pregnancy that your OB or your midwife recommend you take, they cover the cost of those supplements along with prescriptions. Things that even traditional healthcare would not cover the cost of my cod liver oil, but they do, and so that's wonderful, and I'm thankful for that.
Which is awesome, and that goes into the affordability thing, and that a lot of things are covered. The coverage is great, and you just don't have to pay that much out of pocket besides your kind of monthly what you're sharing with another family directly. And then when the needs come up, that $400,
the initial $400
off the top.
So with that, any medical bill that is under that $400, you just pay that out of pocket. So that means well visits, you are paying for well visits. So like those kind of annual visits that you might take your kids to, or that you go to for a physical or whatever, you just pay for that, self-pay directly to your doctor. But anything over $400, they cover.
And that sort of adds almost an incentive to stay healthy, right? Which is great, which isn't really incentivized in the standard health insurance world.
Yeah, so another thing about it is you can join at any time. It's just kind of rolling enrollment. Whenever you decide to make the switch, jump on, give them a call.
Yeah, so another thing that we've kind of learned more about and appreciated more as we've gone and more needs have arisen in our life is an understanding of how the billing works within kind of the health insurance and healthcare world, and really, honestly, the lack of transparency and accountability that there is within that. Like it's kind of been crazy as we've reviewed medical bills that we've gotten back, like how many things have been wrong or off, or like even things that we didn't receive that treatment while we were there.
Yeah, I've had to make calls about like, this is not right. Like, this is not accurate. This needs to be changed. And they've always worked with me, and we've always gotten it right in the end. But there has been multiple instances of revisions that needed to be made to bills.
Well, and like we've gotten the response back from people where they've said like, oh, we always just tag that on when this occurs. When somebody goes to the hospital for this is always just associated with it. And when we're like, well, it wasn't.
Didn't get that.
We didn't get that. And how many other people have had that same thing happen that did not get that either. And it just makes you question and wonder like how much transparency and accountability there is with some of the billing that happens, and things are just passed through or whatever.
It's been eye-opening in that regard. So another thing that has been a big plus for us, like I already shared, is just the direct kind of member to member. You are sharing money with someone directly for their need. You get the opportunity to pray for them, to know what's going on, and to give money directly to them without any middleman in between. We really like that.
Yeah. And another kind of going off of that, another pro is the customer service that you receive is like top notch. You're always talking to somebody directly on the phone, and you just get the feeling that they like genuinely care about you, your situation. You deal with them more than I do.
They're super helpful. They answer quickly. They're super helpful. You're not waiting on hold for a million hours and frustrated, but they are just so kind and so nice. Like, it's such a pleasant experience. I never I remember when we used to have Blue Cross Blue Shield, like dreading those phone calls because they just always felt like I was sitting on hold for hours and it was like just miserable. But these people are so pleasant to call and just always offer encouragement and help and support. Yeah, so I think overall, the big pro for us, and really why we ended up switching here, is it just aligned better with our values. We were able to see the doctors that we wanted to see, the practitioners that we wanted to see. I mean, they just do a lot more supporting kind of natural options and just some unique options that traditional healthcare doesn't, and it just was a better fit. And even they only pay for things that also go along with their values, that some things that traditional healthcare pay for that we don't necessarily are on board with. And so it just is a better fit for us and for our values and where we are, and we really loved that about Samaritan.
So then to get to some of the cons, and we don't actually mean cons because it's really just more like this is the reality of the system and how it works and how it needs to work. And so we don't view these things as cons. At times they can be kind of tedious to go through. There's certain steps and things that you don't have to deal with in the health insurance world that you do have to deal with Samaritan, but in a lot of ways, we view it as, we'd rather have the ball in our court instead of
and we get the opportunity then to be stewards and to be in control and to understand where our money is going and kind of what's happening.
Yeah, you kind of act as your own ambassador through the process, which we appreciate. And so the first one is that just the reality that Samaritan Ministries is a faith-based kind of program model, and so it's Christian-based, and so there are some kind of minimum requirements based on that. One is that you have to sign a statement of faith along with it every year on an annual basis. And then two is that you need to have a pastor or leader from your church that you're attending kind of sign a statement saying that you're attending church regularly.
So some other things about Samaritan that might be considered cons is that you do have to pay out of pocket up front. So not always up front, depending on what the procedure is. So some things, like if you're getting a prescription or a supplement or something like that, you are going to cover the cost of that, and then you could submit the bill and get reimbursed for it after the fact. Or with larger medical bills, what we've always done is instead of when I get a bill in the mail, just paying it right away, if it's for $15,000 for my son's hospital stay or something like that, I don't just pay it right away. Actually, I found that healthcare providers are super, super flexible in working with you. One, at giving you time, and two, at working with you on things like a payment plan and stuff to spread that out over many, many months. And so it typically takes, I would say, 3-ish months from when you submit a bill to Samaritan to actually get that money to get reimbursed for it, which I've actually heard is pretty quick compared to a lot of other sharing organizations, just what I've heard. So it usually takes about 3 months before I submit a bill and before we receive the money for that bill. If I get a bill in the mail, I usually, if it's a small bill, I might go ahead and just pay it right away and wait for that money to be reimbursed to me. But if it's for a larger bill, what I usually do is call the provider up and ask to be put on a payment plan. And even they'll often let you wait a couple months before starting that payment plan until you start receiving that reimbursement money, and then set up a payment plan. If it's a significant bill, maybe you're paying $500 or $1,000 a month until it's all paid off. We've found that to be a really easy way to handle it, to make sure you get all the money up front and then can pay that medical bill off over time. And then the other big thing with Samaritan to make it just maybe require a little more time is that, like Jim was saying before, you just really need to be your own personal advocate. And so it's kind of up to you to shop around for the best prices on different, if you're getting a procedure done, you might want to call several doctors, and that really helps Samaritan out too to lower their costs. If you shop around to several providers, and actually you might find that one is significantly less and actually might be just as good as someone else, and so you're going to end up paying significantly less for that to be done. And then, like Jim said, it's just really taking time to kind of analyze your bills, making sure it's all correct, making sure you receive the correct discount. If not, calling those companies up and requesting that discount. And I have had that happen several times where I got a bill, we were self-pay, it maybe did not have a discount. I called them up and instantly they gave me 25 or 30% off that bill just with one phone call. And so, but you just have to kind of do the legwork on that, and you have to make it happen. But then also Samaritan's really easy to work with if you have questions along the way. But those are kind of just some of our, cons of just needing to take a little more time to do a little more digging and research. And I think basically how I found it is it was a little intimidating and overwhelming at first, learning a new system and kind of managing all of that, especially once I started having our first need and needed to submit bills and how did all this work. But quickly, once I started doing it, it really became not a big deal, really easy, really streamlined, and I was quickly able to figure it out. It just takes it's just a bit of a learning curve in figuring it out. But once you get there, it's really easy to to do it and to make it happen. And the results have been awesome. We've really loved our experience. We refer lots of people to it and just share.
A lot of our family and friends are on it now.
Yeah,
They're told
yeah.
about it. That community aspect of it, that you are literally sharing your dollars directly to another family. You know their need, and you can pray for them, you can come alongside them, and you can support them. And then, you know, same coming back to you, and the encouragement and the notes that you receive of people letting you know that they're praying for you and they're happy to support you with their money. It's just such an awesome system and kind of picture of how the body should be working together to help each other out and come alongside each other.
So that's been our experience, but like I said, if you have more questions, if we realize it's a little bit complicated, feel free to drop them below. We'd be happy to kind of just share more about our experience, or just, they have a ton of information on their website, or like we said, their customer service is top-notch, excellent. So give them a call, ask them questions. They're really there to help you. Thanks so much for watching. We hope it was helpful, and we'll see you in the next one.